I've seen you as a student. I've been a student UG and postgraduate in this institute.
From KEM, huh?
Yes, yes. I was
GS&KEMH.
94 batch.
Alright.
GS&KEMH. 94 UG batch.
Okay.
And for last from around 2000 up to 2010, from 2005 to 10, I've been in Sai Hospital as a lecturer, and from there I came back to general surgery, assistant professor.
Okay.
So
you are quite familiar with both the places where I worked.
Yeah.
Sai as well as this place, yeah.
So what are your most memorable accomplishments in the college? We just want to know, hear from you the stories about how the KEM evolved on your career and how things around.
KEM had evolved even much before that. I mean, it was a fully mature institution. There's no question of me being a part of the evolution. But
So we can start from the start. You're joining medicine onwards, as I mentioned to you.
We started my childhood, yeah, we can. We can. No, I always was fascinated by uniform.
Okay.
So, always wanted to be in the army. And then the second choice was becoming a doctor. So, because in our family there is not a single doctor, all of them are engineers. I got into Armed Forces Medical College, so I said, this is fantastic. I was going to pass out as a lieutenant, surgeon lieutenant, so I was very happy. And suddenly I realized that I had ankylosing spondylitis. So they said that you're unfit to join the forces. So then they made me, then I had to come down into the civilian line looking for registrations. The first time I saw KEM was actually in 1974. I just finished my internship and I had applied for a house post in KEM. I had got a registration as well. But then I didn't realize that you had to pay your fees in time. You had to come down and pay your fees in time, you had to fill up your forms in time. And I was very laid back, so I didn't do that. So I lost 6 months. So then I got registration in Sion, finished my post-graduation in Sion, and then I worked as a lecturer in Sion. In '84, I was selected as associate professor in surgery. And those days, we had a very peculiar arrangement. An associate professor worked in 2 units in a single ward. So I was in Ward 7 working with Dr. Bhalirao and Dr. Devdar. 2 persons as different as chalk and cheese. One was a bludgeon. He would bludgeon you to death if you made a mistake. The other guy would make you bleed from 1,000 cuts from a sharp tongue. So that was Dr. Bhalirao and Dr. Devdar. But then if you had the patience to keep your ego aside, you learned a lot. Because I was quite a good speaker and presenter, but then Dr. Devdar made me hone it so well. He taught me, he made me practice, he made me rewrite papers several times. So he really taught me a lot. And Dr. Bhalirao, I remember, don't come to surgery if you are afraid of blood. So I remember he used to remember huge spleens, and then we had to be ready to catch the spleen because we just put his hand there and just pop it out. And then later put in bed sheets to control bleeding and stop catch hold of the splenic artery and splenic vein. So it was stressful but enjoyable. So then I went overseas for a year, Commonwealth Fellowship. That changed my outlook because one comment from my professor, he told me that MS is okay, but FRCS is something else. So I said, okay. I just kept quiet. The next day I talked to my wife, I said, let me apply for a fellowship. And that was the first time that they had made fellowship into 3 parts. Part A, Part B, Part C. And you could take all 3 parts at the same time. So we didn't have so much of money that I could appear and reappear. So paid the money, appeared. And me and one more chap from Africa were the only 2 people who passed all 3 parts of FRCS, single shot first. So when in the evening when they gave the results, the president of Royal College of Surgeons for Edinburgh was Professor Lister. He is Lister's descendant. So he invited all of us who had passed newly elected fellows for sherry and some sandwiches. And then when we were doing that, he went on shaking hands with everybody. And then he shook hands with me and asked me, "Well, what are you doing here now?" I said, "I'm a professor and head of department of gastroenterology surgery in DR.SUPE." And he got such a shock of his life. He said, "You're a professor and you appeared for fellowship." I said, "Yeah." "So why did you appear for the fellowship?" I said, "I just wanted to study the methods of how we examine. And how good is that examination as compared to the examination we have?" So he called all his other friends from there, the assessor, the deputy president, and the secretary. He said, "Come and meet Professor Shirahatti." So he is a professor and he has appeared for the fellowship. And that was one of the beautiful moments. And all I did next day was just to give Alan Johnson was the guy I was working with. I gave him the fellowship certificate. He said, "The fellowship is okay, but MS is better." So that was great fun. I worked as a professor and head of department in gastroenterology surgery in Naya Hospital. That was almost for 8 years. And then we were the guys who established laparoscopic surgery in government hospital for the first time, along with Dr.M.V.L.Kothari in JJ. And those days we didn't have the equipment. So what we used to do was, we had bought a Videocon TV, a small 14-inch Videocon TV, use that as a monitor. Can you imagine? A horrible way to do things. We didn't have an insufflator, so we used to use a sigmoidoscope hand pump to inflate with air, mind you. It was considered to be dangerous, but we did laparoscopic cholecystectomy with that. We did thoracoscopic esophageectomy with that. So we were doing good work, and then one fine day I decided that why not try and appear for the Dean's interview. I talked to my wife, and my wife laughed at me. She said, "You're being stupid." She said, "It's a political course. You have no grandfather." So, and secondly, people say that the selection is already made and this interview is just a face wash. So I said, "No, but I'll try not to." So I said, "Why don't you ask some of your senior members of faculty what they feel?" So I asked Dr. Bhalerao and I asked Dr. L. Both of them were very clear. They said that you're a clinician. You're going to miss your clinical work, but I think somebody has to take over administration and do something. So why don't you take it? I think you should do it. But just say, don't forget your clinical work. Don't forget your teaching, because these are two things that keep your ears to the ground. You know what's happening in the hospital. So I appeared for the interview, and the interview, boy, was it fun. It was stormy. It was absolutely stormy, because there were three people in the interviewing board who had already decided that they were going to give it to XYZ. And then there was an additional commissioner of municipal corporation who kept on trying to see if I could break in the interview. And the interview went on for about an hour and a half. Very long interview. Because I was ready with facts and figures. I knew what was the financial status of the municipal corporation, how much is their grant, how much is they spend on salaries, how much is returned back unspent. All these days I had studied. So at the end of it, because I had decided I'm not going to get it, might as well enjoy the interview. So when I came home in the evening, Dr. Mrs. Deshmukh calls me. She was vice chancellor at the time. And she was my teacher. So she said, "Shirahatti, what have you done?" I said, "Ma'am, what happened?" She said, "You'll know in 2 or 3 days, but what have you done in this interview?" I said, "No, I had fun." So she said, "Okay, congratulations." I kept the phone down. Then I told my wife, "Looks as though I'm somewhere in the reckoning. I don't know what happens in the end." And next week, sure enough, I got an appointment later as dean. When I went and met this lady who was the additional municipal commissioner, the first 6 I had taken sweets. So she says that, "Sivan, so you've been selected as dean?" Yeah, I said, "Yes, ma'am." She said, "Welcome to the headache. You'll regret having applied for the dean's post. But I think you can, if you think you can do well." I said, "Okay, fine." So I was posted in Siam. And Siam I had done my residency. I was a trauma registrar, and we had established a trauma services there the first time because KM refused, so Siam took it over. The first day when I landed, there is a house collapse close by. Around 200 people got injured. So all of them got admitted. So I said, "Welcome home." It was great fun going back to Siam, back into that thing because Sion was more or less like a frontier hospital. KM has always been academic. Nile always had the best equipment, as I could see. But Sion had the best atmosphere to work. So I was very fortunate. I was exposed to all three hospitals. And then we had this food poisoning in Bhiwandi, where we had about 200 people who got admitted and about 150 died. So that was a challenge to manage because we at any time during that period, we almost had around 30 patients on ventilators. So to arrange for those ventilators was a big thing. So we found out the companies, we pulled in a lot of favors that they owed us. So we got 25 ventilators, put all that in. And then it was a bad thing because even now we don't know what caused the poison. Because we collected samples, we gave it to one of our microbiologists who was going to Atlanta. So she smuggled it to Atlanta saying that, okay, find out if there is, we are thinking thallium poisoning, we are thinking of all kinds of things. And then finally she took it in her luggage at a risk because if she had got caught in the American airport carrying biological material, she would have been in trouble. But then CDC Atlanta did a whole toxic scan, they didn't find any poison. So finally we landed up saying it's possibly Datura and left it at that. It was fun. So then I was transferred here to KM as the. And KM, I remember the first time I came, I saw the OPD hall. I said, what a waste. Because this is a place which can be converted into a full-fledged emergency medical service. And nobody had it in India so far. So I had made a nice big project report. The cost of it was around 3.5 or 4 crores. So I said the only persons who can afford to give us this kind of money is possibly MMRDA. So MMRDA chief at that time was somebody I knew from before. So I had taken an appointment, I was supposed to go, sitting in the office. This young man walks in. So I was introduced by Goyal, who was the head of neurosurgery, saying that sir, he has donated a table for the neurosurgery department. He's a very nice person. So we shook hands, we sat down and talked. And finally he kept on looking at the table and he says, Doc, what's that? I said, that's a proposal that I have made for the emergency medical services. I'm going to MMRDA today. So for getting grants if possible. He says, can you give me a copy? I said, no, yeah. I said, this is too much for a single person. 1.75 crores in 2000 was still quite a big amount. He said, but even anyway, give it to me. I said, okay, take a copy. I gave it to her because I remember Mrs. Malik was at that time. So we made a copy, gave it to him, and he took it home. In the evening I get a telephone call from the same guy saying that doc, I'm pledging 1.75 crores. I'll give it to you. So I told him I have two conditions. One, I don't want to see your money. Two, we will choose the equipment. We will do the haggling. We will settle for the price. We will tell you, you pay. We're not going to see any money. We don't want any financial transaction. If you want, you haggle with them, you negotiate with them, you reduce the price to whatever you want. We will recommend that this company, this equipment. So he said, fabulous, no problem. So then we used to take rounds almost every other day. We had decided, because about 2 months back, Narayan Rani had come here, the chief minister, along with Narinakshi. You remember Narinakshi was the municipal commissioner. So he says, Dr. Sahib, kai, evada gahan hai hospital. Kinduja baga. So I told him that there is a difference between an airport and an ST bus stand. We are an ST bus stand, they are an airport. I said, both of us do the same work. Both of us take people from point A to point B. And I challenge you. You come next year and you will see something different. So we had decided that we wanted to do it. And Sunil, who was the guy who donated, he and I, we had decided one thing was sure, that we are not going to make this into a typical municipal. So Sunil said, I know an architect. She will come and plan all that. I said, yeah, who's this architect? So he said, Brinda Somaya. I literally jumped from my seat because Brinda Somaya happened to be my friend's wife from AFM. So I said, okay, fair enough. She also happens to be a very tough lady. I am a short-tempered chappy and we used to sit here and have fights about the color of tiles and how the whole thing had to be planned. But finally, it was a decent enough place. We put on the equipment, we inaugurated it, the Chief Minister came to inaugurate it. And it was great fun. So after about 6 months, this lady came in, Sudhamurthy, Narayanmurthy's wife. And she phoned up home, my wife picked up. So she says that, I've heard that your husband has established emergency medical services. I want to come and see because my father studied in Kenya. I said, okay, please come. Evening she came, she had a cup of tea. So I said, come and show you. So brought her here, showed her the emergency medical services. She was absolutely quiet, she saw everything. And then she turns around, Doctor, how many years did you take to make this? I said, what years? We did 6 months and we finished it and we inaugurated it. So she just nods her head and goes away. And then, again 2 days later, I get an email from her saying that I am committing 2 crores of patients. So what do you want to do? I said, we want to computerize it. We want to computerize the entire hospital. The same rules apply. I don't want to see your money. You appoint a software person. We will tell him what to do and he will write the software the way you want. And we will tell him the requirements, he will buy the notes and the server. So that worked. And by that time I had got an offer from India, so I took voluntary retirement, left. I think the only decision perhaps I regret. If I had continued on, maybe I would have done some more. And the president came the next year to inaugurate the emergency medical services. So it's been eventful, it's been good fun. One thing I realized, as a dean, you can do one of the 2 things. You can sit on the chair, increase your weight, and think that it's a sinecure, forget about it, and go home at the end of it, say that, okay, I survived. Or you can get off your chair, go into the hospital, see what's happening. Because I realized very early in my dean's career that one decision that you make or one thing that you can do changes the course of so many people who attend the hospital. Cleanliness for that matter. I used to be mad about cleanliness. I used to hit people. If they spat in the hospital corridor, I used to hit them. My wife used to say, one of these fine days somebody is going to turn around and slap you back and you'll have it. I said, no, nothing do you. I used to hate people chewing pan and spitting on the walls. So we got some people to donate money. We put, rubbish bins all in the corridor. I don't see them anymore. And they were all lined by plastic bags so that the plastic bags could be picked up. Yeah. Great fun.
So any ideas about your interaction with students?
Students have always been, I used to love students. I was very informal with them. So I had the dean of JJ once. So we were walking down the corridor and the students wished me, morning sir, morning sir. So I was like, hi guys, how are things? So the dean of JJ was shocked. He said, how can you say something like that to them? You got to maintain your dignity. I said, what dignity? I mean, they were kids, yeah? There's no problem. The students are so wonderful that in one of the days when these chaps were on strike, the Municipal Mazdoor Union chaps were on strike, so the whole hospital and the college was sweating. I walked out of the office one day and I had tears in my eyes. I saw my students with brooms cleaning the corridor. So I said, well, why are you doing that? They said, sir, this is filthy, we're cleaning. So they're super kids.
Any surgical or clinical challenges you must might have faced?
Challenges are plenty. And for every challenge I have...
memorable.
Every challenge I have learned myself. I still remember my first venesection that I did where I cut the brachial artery. And then, my professor who was there came and helped me out. I had tears in my eyes. It was within first 15 days or a month of my being a resident. And then I cut the brachial artery. It was terrible. Only saving grace was 100% burns. Even if you didn't do anything, the patient would have died anyway. But cutting the brachial artery, for heaven's sake. Or the time when one of the senior, Dr. Chowkar assisted me for first splenorenal shunt that I was doing. So he was there till I finished the shunt. He said, Shirahatti, me basla. You tell me whenever you want me to go, I will go. So I said, okay. I finished then. I was feeling very grand, so I took my gloves off. I was a senior lecturer. Then I told my husband, one karna hai. So I went to it. So the fellow said, yes. You close the patient? I said, no sir. Husband, the registrar's closing. Shadow crossed this patient and tell me anything. Suddenly there was a big hoo-ha in the corridor. And the scrub nurse comes running to me. He said, "Ek mock milk." So we had to go back, I had to wash up, I had to search. The mop was not inside, but fortunately it was down underneath the table. We found that. Then I told the registrar, "Well, that's I'm finishing." I still remember what Chocolate told me. Never, ever wash out before you finish the last skin stitch. Or you'll be there. You want to give the registrar, that's fine. But you as a supervisor, you supervise, it's your responsibility. So there's so many things that you learn as you go down.
Is any difference in you card? I mean, what are the major differences working in a municipal hospital and in a private?
In a private hospital, see, the private hospital is very simple. I was fortunate in working in a private hospital which still has a lot of, they still keep a lot of ideals intact. They're not corrupt. See, this hospital is not such place. But even then, I mean, the way we treat patients, here the way we treat patients, it's totally different. They are interested in saving a penny and earning a penny. Here we are not interested in that. I still remember Professor Markani, when he became Dean of Science, he had a brilliant idea. He says that make a bill for every patient who goes home, showing how much it costs to treat him. So he says that will do two things. One is it will tell the consultants how wasteful they are, and it will show the patient how much money is spent on treatment.
It's a nice idea.
But anyway, as all good ideas, they never came into existence.
So any message you want to give to the present generation of students or
They are. I agree with Dr.R.G.Shirahatti. The students have always been the same. They are very enthusiastic. The fault is not there. The fault is on this side of the table. When the guidance is lacking, or when we don't guide them properly, or that enthusiasm is not channeled properly, then you always end up blaming them. Nowadays, look at the students. They don't respect their seniors, but you don't earn the respect. You have to earn everything. But I think from what I was talking the other day to Aparna, this supply of stuff has improved, I understand. Because during our time we used to steal things. Police catheters were usually stolen and kept in the houseman's bag. We used to steal IV cannulae and steal it. And there was a vigorous barter system going on. One houseman would say, yeah, police catheter, we used to tell him, okay, it will cost you 4 IV cannulae. And the most expensive thing was the proline, 5060 proline, that we never used to give it to anyone. But nowadays I understand that Aparna told me that they can give hyperalimentation for a month without any problem. Hyperalimentation was like liquid gold here. We couldn't get it for our lives when we were residents. That has improved. So many things will happen over a period of time. I wish only one thing. Municipal Corporation runs what? 3 municipal medical colleges, 1 dental college, now 4. We take R.M. Cooper as well. 4 medical colleges, 1 dental college, then we have 31 or 37 big peripheral hospitals. We have 165 dispensaries. We have a complete infrastructure as such. Why the hell can't we get out of Mumbai University or MUHS? Call ourselves deemed university, municipal medical university. This was tried anyway, around 20 years ago. Municipal commissioner was called by the chief minister and he told him that would you like to be posted to Gadchiroli from tomorrow? So that proposal was dropped. Otherwise the proposal was already, we would have been set. Because look, who gives us the money to run the medical college? Nobody does, municipal corporation does. So why should we listen to government people?
I would like you to elaborate on Platinum Jubilee celebration because you were there.
Jubilee celebration was like almost as I was having my daughter's wedding. that kind of it was very, there are a few things which we did in Platinum Jubilee, I think was wonderful. You know, we called I called all the heads of the department and told them that look, why don't you have one day which should be a departmental day when you call all your ex-departmental people. Advertise and call them, they'd all come. And they were felicitated. So it was fantastic calling surgery. Many of these guys were my teachers' teachers, you know, coming here. It was fantastic. And then each batch had a get together. And then I was called to speak on all these get togethers. And some of these people like GB, Farolkar's batch, they were 1950s batch, I was just born then. So, you know, speaking to them was fantastic. And then we had a very nice program in Shanmugananda. I think we had the health minister who had come. But the whole year was full of activities. I'm just waiting for the centenary.
Rama has few questions pertaining to various facets of these activities.
That's good. Oh, the budgeting and fundraising. Yeah, it's very simple. Like fundraising just happens because once you establish your credentials, there is no lack of donors in this place. People will come and donate money. All they want to know is that is my money being utilized in a proper way. And even the municipal corporation, you will be surprised that if you know which buttons to press, you will be able to get the money for you. Like this emergency medical services, half the money was donated by the trust, and the other half of the money I got it from municipal corporation. Because at that time I used to go and bother the municipal commissioner so much that finally he agreed that he has to give. Budgetary deficits, Mrs. Manik, I don't know what's the situation right now. Because during our time we used to have, it was not deficit, I think it was misuse of it. Oh yes. Leadership and vision, I think that's the most important thing. Because when I joined here, KEMH Hospital, GS&Medical College Dean's office has always been a very intimidating place. You know, if you landed up here, either you went across to the loo, that was the loo there, or you came and met the dean. So either way, you are uncomfortable. So one thing I think which happened during my time was that people weren't afraid to walk in. We invariably used to have a group of people who would come after they finished the work. They will be sitting there, we will be having this cup of coffee, and then we will be talking about various things, you know, how to improve, what to do, so many things.
Since you mentioned about that, you do complete that, how you change those.
Yeah, so because see that, first of all, it was a eyesore here. Every time I used to walk into the office, I used to smell the loo there. So then finally we decided that we wanted to change. Change it to what? So finally we realized that we didn't have an office for the alumni. So that was made into an alumni, and then we inaugurated in the 75th year. And we had a first MBBS student who was the youngest student, and we had one of the oldest students, I think it was from the 1937 or 38. They inaugurated. Oh, progress, yes. Before I joined, or the year I joined, KM was 8th in the list of medical colleges. When I left, it was 2nd. How do I feel occupying the chair? Very, very, very humbling experience. Because when you sit in the chair, you suddenly realize that Jivraj Mehta sat in the chair, Dr. Daigude sat in the chair, and so many giants sat in the chair. And then you would always keep thinking that if a problem arose, how would they have done it. It's a very, very humbling experience. But at the same time, you feel great. The very best. One of the things which I had talked to, the local politicians and municipal corporation people, that why don't you sell medical insurance? Specialized medical insurance, maybe $100 per family, to people living in this area. So that when they came to KEM, they would get free treatment, but the insurance company would pay for some of the things that they did. And that would have worked because the population out here it's quite a big population. So if they all register here, like for example take cardiac surgery, in any case you give them prescriptions, ask them to buy things from outside. Instead of which, if we had them insured, then the insurance could pay for that equipment and the rest of the thing. And they would get much better treatment and KEM would not be losing so much of money, on these things. I don't know if that's going to happen. It's ever going to happen. Oh, riots, bomb blasts. But that experience is not in KEM. We were fired upon in Nayar. From across the road, there was a building across the road, and then we were in the emergency. We were in the trauma ward, and the trauma ward in Nayar Hospital has got big plate glass windows which face the glass. Suddenly it went crash in the evening, but I was there as a professor. So everybody thought that somebody had thrown a stone. Till that time we turned around and looked, there was a nice round hole. And then suddenly, tack, 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 3 more of them. So we had a platoon of Gorkha regiment people there who were posted at that time because the army had just been called. So those guys just rush in, right? And they say, light band karo, light band karo, light band. Everybody switched off the lights there, down below the level of the windows. So everybody, started saying the last prayers down below the windows so that people couldn't shoot you. And then you turned around and you found that the Gorkhas had gone. And then you carefully peeped over the windows and saw them across the road. Next 5 minutes later, you saw 20 people with their arms above their heads coming up. So the people had fought all of them. It was one of the scariest experiences. Because as doctors, you are used to seeing bullet wounds, you are not used to being shot at. Anything else? No, you are right. Once you start, it isn't painful. You are not having coffee? Look, I'm not really qualified to comment on the standard of medical education because I am not taught here for 15 years. But from what I know, hearsay, the strength of Indian medical teaching used to be the emphasis on clinical training, and we were second to none in that. So we were fantastic. But then we had big lacunae, like for example, critical thinking as a researcher. These were traits which were never ever developed in India, almost. Because when I went to the UK for the first, on the Commonwealth Fellowship, I knew as a professor I could hold my own against anybody as far as surgery was concerned. But then the moment they started talking about standard deviations and means and modes and the rest of it, they would leave me far behind. That holds even now. When I went to the US, they have an association of doctors of Indian origin. And then in that they have a branch which is Mumbai. Many of them are ex-KEM students. So they met me and they said that they had no problem in integrating in the US. As a matter of fact, they were welcomed because they were hardworking, they knew how to operate, they knew how to take care of patients. But the main problem was research. So that used to be the main thing. So our strength was the wealth of clinical material we had. And from what I understand right now is that hardly any teaching occurs in the world. I mean, I don't know how far it is true. But then this is what I'm told. If that happens, then the only strong point that we had is also taken away. I don't know how good our students do. I feel bad for them. And secondly, the world has moved on. We are the people in India who have, somebody made a very nice remark. Sometimes poor people are so proud of their being poor, they don't want to improve. They are proud of their poverty. So therefore we are like that in India, where we are so proud of our heritage that we don't want to change. The heritage of medical education which came from the British, but the British themselves have changed, we haven't. For example, we still are very much speciality-based curriculum. People have changed over to a totally integrated curriculum, an outcome-based curriculum, and a curriculum where the exposure to patients starts in the first year. Whereas our people start seeing patients in the third year, second or third year. So there's so many things that can be done. But then to do that, I think you need reforms at the highest level, that's at the MCA. And nowadays I understand the Niti Aayog wants to take over MCA. I don't know what they will do. Your questions also that you set in the university are still the same old format, is it? They have changed? They're multiple choice questions or?
Both.
Because when I was in Saudi Arabia, the university changed its curriculum. It was running a classical specialty-based curriculum, and then they wanted to change it to a problem-based curriculum. So, the Arabs, they have lots of money, and money is not an issue. They wanted to see where was the best place. So, we had formed a small committee, and we went around the world literally to various medical institutions, looking at their curricula and then finding out, discussing with them how much it's going to cost and whether they will implement it or not. And then finally we narrowed it down to 3 places. McMaster's from Canada, then Groningen University in Netherlands, and Maastricht University in Netherlands. These were 3 places. So finally we bought that curriculum from Groningen University, paying them something like €1 million. And we started setting it up. But the problem it is there is that problem-based learning involves a lot of self-study. And it involves a lot of looking for information on your own, finding out everything else. Most of the students, or rather all the Arab students, are used to the old standard spoon-feed kind of system in the school. So once they are into the medical college, you expect them suddenly to start looking for information on their own. You find it's a big problem. But that problem I don't expect to happen in India because our students are already computer savvy. They know how to look for information. So even problem-based learning, to my mind, is not an ideal. You should sort of tailor it to what our students need, and I think we can do it very well. Your chaps had already been doing it for how many years, along with Dr. Kothari? You used to make the students present, you had assignments for students, so that the students knew the value of work. But that can be made formalized into that. Even the exam assessment, because you know as well as I do that it is the assessment which drives learning. You decide that the journals that they carry, if they are not complete, the student is going to fail, then you will find beautifully written out journals. If you say that, if they fail in theory exam, that means they are failed totally, that means you will find people studying. Right now, your final MBBS results don't matter because they have to appear for another exam. So therefore, that has already driven their studies, they are not bothered about their final exam. But they will be studying for the selection exam. But why can't we have a system by means of which, say, suppose they get X amount of marks minimum, only then will they be eligible for the selection exam. Then there will be value for the final MBBS exam. Who's bothered here?
12वीला 50% म्हणजे फारच त्यांनी खाली आणून ठेवलेले 50%.
No, even in Saudi Arabia, the vice chancellor had called me and he told me, Prof, why don't you make a position paper on selection of students? He said, look at the kind of students we're getting in medical college. They all fail. The failure rate was quite high. So I made a nice big position paper for him, saying that you have to set up minimal criteria for them to be eligible for application. And then you don't look at only academics. Because academics is just one aspect. Medicine is all about the human touch, communications. And unless we can judge, unless we can test that, then we are going to select wrong type of people. And that we keep doing even now. Even in India, what matters is the marks that you get. That should be one of the considerations, but not the only.
But only in science subjects, it should be
Overall. And Dr. Kothari and I were the only two people who agreed that they should have a non-medical subject in their class. Have history maybe, have philosophy maybe, have something else. Have literature. It widens a person's scope. Like you talk about some of the old surgeons, like even Dr. Dev. After his rounds, there was a time of about 1 hour where we used to sit down and prepare the list for the next day. That was 1 hour where we would discuss from Milton to Shakespeare, from Edgar Allan Poe to the other novelists. And then we would be talking about Mahabharata to Ramayana and everything, because these guys were well read. But nowadays, I don't know. I mean, I think we are in that particular very, very tunnel vision. We know just our speciality and nothing else. Like Dr. Bhalerao could hold you spellbound talking to you about the history of Marathi stage.
So any memory about the other bosses, other units heads around in that time?
Samsi was one of those guys you instinctively went to if you had any problems. They were very, very, very nice guy. And then he would give you very good advice. C.V. Patel was another person who would be. I remember once I got in trouble while doing an abdominal perineal resection here, and I opened up the presacral plexus and it kept bleeding. So this was 4:30. So the only person who was available on campus was C.V. So I told him, can I please come? He said, of course I'll come. He washed up. And then, people used to say of C.V. Patel that if there is a complication on the table, he actually becomes bradycardic. So he becomes very cool, very quiet. He says, don't worry, just pack. We'll wait for 5 minutes. All bleeding will stop, don't worry. I was associate professor at that. So finally he stayed with me till 7:30, and then all of us were poor here. We used to go by buses. So he took a bus from here all the way to Western Suburbs, someplace where we used to stay. Very, very, very cool person. And in some sense on the other side was Shenoy. Shenoy was my contemporary. So another brilliant character. The chap was very brilliant. And then in Ward 5 was Ravi Mahapai. Who else was there in Ward 5?
Reggie?
No, Reggie had passed away with it. CBN. CBN.
Do you think doctors have correct persons to become dean?
Why not?
No, I'm just asking.
Yes.
Because most of the private hospitals keep CEO are not very good.
It's a very tough question to answer, honestly. I had no experience in administration. None. Zero. I hadn't even administered more than 2,000 bucks, which was the limit for a head of department. I honestly don't know how I managed. I mean, it was only enthusiasm and willingness to learn, which in the modern days I think is not adequate. You need to at least have a background of some kind of administration But then later on I realized that incidentally I had registered for an MBA after I resigned as dean, and I appeared for an entrance test in this place, Wellington. And I must tell you, this is a very funny experience. They had an entrance test which was a written test followed by an interview. So I was in Hinduja Hospital as medical director. So I applied, so they didn't know who I was. So when I went for the entrance test, suddenly one chap comes and touches my feet. They were all kids. They must be about 22, 23 years. I was the only old man around the place. So the fellow comes and touches my feet. I said, just one second. I said, who are you? He said, uncle, you don't remember me. He said, I'm Lala Purohit's son. Lala Purohit happens to be my friend. His son and I were competing for the same buddy seat. So then finally the administrative officer recognized me. He said, sir, tumhe kya karte ho? I said, I'm sitting for the test here. So finally I appeared for the test and then I stood first there in that thing. Very embarrassing situation to happen with all the kids around the place. So when I did attend that for about 6 months I attended all lectures carefully. I realized that most of the administrative abilities you have within yourself. You don't require any training. Only thing is you learn the jargon. That's all the rest. So to answer your question, can a doctor become an administrator? Yes. Provided he is willing to take risks, provided he is willing to face criticisms. God knows I faced enough criticism during my tenure. It should make a difference.
No, but can, even in private hospital, a doctor would make a better administrator?
In private hospitals? I worked in Hinduja. As a matter of fact, they had promised me that I would become their CEO. In 6 months' time, a promise which they reneged later. That is different. Yeah, you can. But then it's tougher. Because here you don't worry about money. There you have to keep on making sure the bottom line is there. And to keep the bottom line on, you must know some degree of finance. You can, but
does that compromise with medical services?
being the doctor being an administrator?
No, other way. Because
It does. Okay, let's look at it like this. I mean, there used to be a time when the Cricket Board of India used to pay their players very badly and they used to treat them like servants. Because there was a feeling of envy by the board members who never played cricket towards those people who played cricket and got them money. The same situation exists in private hospitals. The non-medical administrators are jealous of doctors who are the earning people for the hospital. So there is invariably a tussle between the two. And so it all depends upon the chairman or the final board of directors or whatever.
Because recently I read an article which showed very clearly that all CEOs who are non-medical are earning more.
They are earning more.
They
I don't know. During my time, I remember the CEO that we had in Hinduja Hospital used to cry every day.
Now this is what I got the picture. They are earning more than most of the consultants. Abroad, definitely that is the same.
Abroad, there is no question. See, abroad it's very professional. But here, a lot of personal element comes into it. I mean, here, even in a place like Hinduja, a new consultant comes in, he finds it extremely difficult to settle. Because rumors are created, saying that, this guy, he has killed 2 patients already. The mortality is bad. Or the chap who gives appointments, the clerk who gives appointments, tells the patient who comes with a note in your name. He says, Dr.R.G.Shirahatti is not. He's outside, he's gone to Europe, he's going to come back after 3 months. If you want, I'll give an appointment to somebody else. I mean, it's happened to me several times here.
So greed definitely surfaces in various
biggest. See, for example, in Hinduja Hospital, there is a brilliant idea of SP. SP Hindu. And then he called young people from the US, UK, Europe in the 80s. And then he appointed them as hospital-based consultants, where they would earn a percentage of what they earned was their money. You know, so people were very happy because that was the kind of break they wanted at that particular time. Over a period of time, they started realizing that well, they're worth much more than what they're getting at the present. So then the tussle started. So they said, no, allow us privileges for private practice outside. No, allow us to charge what we want. And these are things in private institutions, you can't refuse a consultant who is one of your main money earners. Because then if he leaves your hospital and goes to another hospital, then your hospital loses revenue. So private hospitals, problems are there. But to that extent, I think Hinduja is one of the best run. Very professionally run. Least amount of corruption.
How did your family life match with your professional life?
Professional life, it wasn't affected at all. Because if you're talking about being a clinician, fine. I mean, my wife and daughter were both used to the fact that I would get a telephone call at the middle of the night and I had to come and see patients. But as a dean, I had made a rule for myself. I would not take a single scrap of paper home. I would sit here, finish off everything, including writing letters, proposals, whatever, complaints, everything is to its place. I never used to take my work home. So they never felt the pressure, except in very rare instances when I had to come to the hospital to handle some major problem. Otherwise, there wasn't much of a difference. Because I know other deans who used to carry big piece of paper and they used to look at all the papers and then bring the paper the next day. Never used to do that.
What is the most stressful part of deanship?
Unions. Yeah. But then with the unions again, you got to handle them nicely. They were quite alright till maybe the last 3 months of my stay. Not even last 3 months, last 1 month of my stay. I had no problems with them. But you got to be prepared for so many things, right, Dr. Loka? They burnt me in effigy outside because I hadn't put a board in Marathi on the emergency medical services. But that was just a reason. The real reason was that local corporator's name is not there. So he was furious. So they made the effigy of mine outside and they burnt it outside here. And then they had done Rasta Roko for some time. Then they almost burnt the dean's office down once because the bodies got exchanged. So when Bhaiya came and identified a body as his father's, which it wasn't. So he took the bloody body, he went and cremated it. The only saving grace was that they were both Hindus. If one was a Muslim or a Christian and the other one was a Hindu, we would have had a big problem with that. That was the time I saw the value of the politicians. We had Dr.R.G.Shirahatti, who was a local MLA, I don't know if he's still a local MLA. He was a local MLA at that time. So Dr.R.G.Shirahatti and Mohan Rao who was the MP and the local corporator. All three of them came to the office. This was in the evening. They told me that I remember the way both Mohan Rao and Dr.R.G.Shirahatti told me. He said, "Hey, आमचा घर आहे आणि घरामध्ये problems होत असतात. This problem happens. It's a very bad thing. We will have to first of all calm down the crowd. So if you have to calm down the crowd, you have to assure them that you are taking severe action." I said, yeah, the mortuary in charge, the doctor as well as the servants have been suspended right now. And they were going to register a criminal case of negligence against them. So they went and talked to them, the relatives, and they said, whatever happens, KM hospital is our second home. So make sure that you don't damage anything. You go, Dean Sahib has said, he's already started taking action. And then he's promised us, and then we will promise you guys that we'll make sure that these guys will be punished severely. So the people went. Then later on he comes and tells me, sir, in that particular sect of Maharashtrian people, unless the wife sees the husband's dead face, she is not officially a widow. And where was the bloody dead face? It was already burnt, cremated. He said, it's going to be a big problem for us to explain to the wife. But she said, you don't worry, we'll do it. So I called the mortuary attendant. Because people told me that in the mortuary people are habitually drunk as lords. So I called them, well, given them a firing like they never had before, and suddenly what the chap says, he said, we also don't want to drink. But you stay in that mortuary for a day, you will realize what a horrible, depressing place is this, because death is there every bloody moment. Because you can't stay there unless, he says, your mind is numb with drunk. You are drunk. I have no answer to it. Basically, ideally, we should call them and counsel them on a regular basis. Or make sure that they get shifted out to some other place, somebody else gets shifted. Rotation. It's bad. And those days, that mortuary area sometimes didn't even have lights. It can be a scary place. Yeah.
It used to be scary space, I remember. Our e-lab was there when as interns in the night, at times we had to carry sampling
So I know.
to e-lab. E-lab, emergency lab was opposite before this EMS.
Yeah, I remember that. There were so many of these institutions which have gone away. We used to have a infection OT,
Yeah.
which used to be in the
Skin.
and the rabies ward used to be there. We used to be damn scared going even into the
Last
rabies.
infection is swam to
Yeah.
gas gangrene.
We used to amputate gas gangrene theatre, it was called.
That was scary.
Just the exposure to in life as a medical profession gives the most satisfaction in life, or it has double-edged.
For being a medical guy, as compared to other professions? The way I look at it, I think the three professions see the worst side of humanity. Medicine is one. Police, lawyers. We three people see the senior side of human nature. I mean, I've had a father refusing to donate blood for his small little daughter who was burnt because his logic was implacable. He said that if she goes, it's alright, I can produce another one. He says, if I become weak. I mean, that's the kind of chaps that you see. So, seeing that either you can become a cynic and say that, people are bad, society is bad, it's terrible, we're not going to work. It's not nice. Or on the other hand, you see the small little examples of bravery maybe, self-sacrifice maybe, or people helping each other maybe. Then you start realizing, there's still a lot of good in this world. Being a doctor, there is one danger, definitely. That is when you start internalizing your patient's pain. And that happens in the earlier stages of your career. When you get a patient who's got, say, a malignancy, and it is beyond knife or beyond treatment. Many times you suffer along with him, you used to suffer along with him. For his pain, you also felt sad. Or when that patient lost somebody close to you, you felt sad as well. Over a period of time, you develop a sort of protective mechanism by means of which these things stop bothering you. That is the danger.
Another way of asking this question is, does our profession allow us to have the maximum sense of fulfillment as a person?
It all depends upon how you think. Because finally you think, it depends upon what your concept is of your role in society or in life. And we have always been taught that the doctors are supposed to be very important cog in the overall things. We treat patients, we are supposed to relieve their pain, we are supposed to cure patients. So therefore, as a doctor, you feel great. It's a fabulous feeling. But then every other profession is equally important, isn't it? I mean, but I personally feel that being a doctor is a fabulous thing for anybody. Because you can change, you can make a difference to somebody's life, physically and emotionally. But that is true even of other professions, even teachers. I mean, teachers, engineers, any profession. But then doctors is a little more special because you alleviate pain, you're supposed to treat diseases, you're supposed to make patients feel better. So as a doctor you feel more fulfilled.
Given the choice again, once more, to relive your life, would you like to become a doctor or do something else?
I will be in the army. If I didn't have lesser ankylosing spondylitis, I would have been in the army.
But that is not debilitated you at all.
Sorry?
That
Touch
is
wood. Touch wood. Because I've seen photographs of people who are bent over.
like bamboo spine and all,
I have a bamboo spine.
Yeah,
But then it's limited. It's not bad.
how did you cope up with it?
With that? See, the day when I realized that I was going to be disqualified from being in the army, I cried. And I went to the head of the department of surgery because they made me category C because cat C is unfit. On the basis of very vague findings on the X-ray. So I went and begged my head of the department of surgery, Brigadier Ganguly. I said, sir, please, why don't you ignore this? Because after all, I don't have any clinical sense. So he made me sit down and he says, son, God has closed his door for you, right? And I don't want to open it because if I open it, we know that ankylosing spondylitis is a progressive condition. He says the moment, suppose say it progresses to a degree when you start getting clinical symptoms, you are in the army, then you are put in category C, which effectively shuts off your promotions. He says, do you want to be a frustrated fellow in the army where you cannot get promoted? He says, who knows, God has got other plans for you. You will get into civilian life. Tomorrow you might do well, you might stand first in the exam. Believe you me, after he said that, 2 years later I stood second in the MS exam and I was giving a lecture to my classmates in one of the conferences. So I went back and met him. I said, sir, thank you very much for telling me to get out of the army. No, if I had to live my life over again, I would be an infantryman in the army.
Full-time versus honorary, how did you get it?
Sorry?
Full-time versus honorary system.
Look, I have seen so-called honoraries. The honoraries existed only in the first batch of consultants who joined KEMH or any other medical college. Because the dean went hat in hand and requested them that please come and join us, because then if you join us, it will be a prestigious thing for us. They didn't need the college. I mean, they didn't need to join here. They joined because they felt like teaching and they wanted to give off some of their time. So therefore it is only the first batch or probably the second batch. After that, the rest of the people joined it as part-timers. So you don't have honoraries. You have part-timers and full-timers. So it again depends. A part-timer can be very effective in the 4 hours easier, and a full-timer can be totally ineffective in the time he spends in this place. It all depends upon how eager you are to teach, how eager you are to treat your patients in the hospital. Even in KM there have been several part-timers who spend more time in the hospital rather than outside. They set up many things here in the hospital. They're not. Often I can remember Dr. Bhandarkar, who was endocrinology. I honestly thought he was a full-timer. Till somebody told me, no, he practices outside. He used to be here most of the time.
Very dedicated his life.
Very dedicated. I mean, such persons, even as a dean, I mean, if he walked into my office, if he scolded me, it would be my pleasure to listen to the man because he had the good of the institution at heart.
Permission to do private practice.
I think that was one of the biggest mistakes Municipal Corporation made. You never have done. Because right now what they're getting a salary which is equal to what a consultant starts earning outside. And he does that after doing so much of wrong things. Whereas as a full-timer you are earning what, 2 lakhs now?
As an entry level?
No, not it.
Obviously. 1.5.
So because entry level you don't have that feeling of let me do practice. You want to get experience. It comes at the higher middle level and the higher level.
Yeah, middle level is 1.5 and higher level is around 25,000.
Which is not too bad yet. It's a very difficult thing to answer. Instead of which, what somebody has suggested, they don't have the system of part-timers, full-timers, pay people by the sessions. So they have 1 OR session, they have 2 OR sessions, or they have so many teaching sessions. Pay them accordingly. I don't know about the strength of your surgery department or residents. You have lots of residents.
Yeah, we have, but we can still increase the number of registrations more because there are some more staffs recruited also, more teachers.
Because there was a time, if I remember, in neurosurgery they had something like 22 people, residents, going in.
We have 12 registrations every year.
Yeah.
Year.
You know, but the point is, do we need them? We are paying a lot of people. Secondly, dilution of number of people in the unit. Make sure that each person gets less work as compared to the other. And then the municipal corporation has to pay everybody's salary here. So they have to separate the two things, service, education. You realize how many people you require for service, the college provides. The rest of the people can be postgraduate students. I suggested this, but then I met a lot of resistance from a lot of our faculty. They said no. Or even if a person becomes qualified to become a faculty, why do you want to make him a teacher? Because the moment you make him teacher, he is eligible to have students. The moment he becomes eligible to have students, he has 2 students a year, right?
For the senior level. Junior
Level 1. So let's consider that one unit has 1 senior, 1 junior and maybe 2 juniors. Because the lecturer also may have become. So then you have 3 registrations in 1 unit and you have 8 units. So 24 registrations each year. No, there's so many things we can do. Like there are some departments here which earn money. Radiologist department. It earns money and actually it can be self-sufficient. Why do you want to link it to municipal corporation? Make it a profit center. Let it earn its money. Whatever money it earns, it can plow it back into equipment. It becomes faster. They can get their equipment turned around much faster. They can buy new things faster. You take cardiology, cardiothoracic, they make money. Our labs can make money. They can be profit centers. Why should all this money go to the municipal corporation? It can stay here. Then what you are saying is right. I mean, then even the dean will have to have a degree in hospital administration and finance.
Your daughter did not feel like doing medicine.
She did, but that was the time when there was a big gafla about their entrance exams. So the results had to be recalculated. So finally she couldn't make it. She felt very sad, and I told her this words which my professor had told me. I said, okay, one door is shut, another door is open. Get into engineering, fair enough. So right now she is a vice president in Citibank, in the Citi Group. Whereas her contemporaries would still be just finishing the post-graduation. Life is so long now, you realize that over a period of time, things even. Yeah, but she could have made a very good university. Maybe my granddaughter.
What will you care for now? Something to eat?
No, nothing. I'm going home. My wife's waiting. I'm going home. Thank you very much.
Did you feel nice and very welcoming?
Of this? Obviously. You ask an old man to speak, he loves to speak.
Also, then, any activity should give joy to everybody.
It is fun. It's great fun. Somebody is listening to you, no? Normally you don't get anybody to listen. So it's nice.
I
Thank
remember
you so
small
much.
beginning, I played badminton with
Badminton?
her.
In the who stays in this quarters? No, nobody.
Huh. Maybe.
You are stupid, I would say. Somebody should-
Because they have ruined it by making the station for
Oh, yeah.
there, right there.
That used to be such a beautiful place. Yeah. All her students used to go across the lawn and go into the girls' hostel. Till the time they saw my dog and they got scared. Thank you so much.
Thank you, sir.
Thanks
Thank
a
you.
lot. Thank you, sir.